So if you could keep off your mics if you're not speaking, that will facilitate the acoustic. Okay, people are really coming in now. That's great. Wonderful. From Barbados. Hi, David. Excellent. Wonderful. It's good to know that we got a... Hi, Kevin. Good to see you. We seem to have gotten a good time in the middle of the day to get all the time zones on board. Wonderful. Excellent. One more minute and then we'll delve into it. Oh, I can see Cologne also. Wonderful. Great. Oh, Thomas.
Hi, Thomas. Hi, everyone.
Excellent. Okay, so let me start. So as you all know, identifying and reducing human health risks from wildlife trade within one health framework needs an internationally coordinated and cooperative approach. And in moving from immediate crisis management of the ongoing global pandemic towards a more long-term perspective, many have realized, amongst them us and you and all the attending, have realized that preventing future pandemic outbreaks will need to also address health risks in dealing with wildlife trade and potential spillover, and thus prevention at the core. And to foster this exchange and gain further insights towards this, the International Alliance Against Health Risks in Wildlife Trade welcomes you cordially and warmly to this expert talk today. The Alliance, many of you will know, the International Alliance Against Health Risks in Wildlife Trade, serves as an inclusive and interdisciplinary platform to discuss challenges and formulate solutions vis-à-vis human-wildlife interfaces and associated health risks, and the emergence and spread of zoonotic pathogens from wildlife. We aim to enhance awareness, knowledge, policies, and action, not least by narrowing the gap between science and implementation. And today, it's really great to have you, Catherine. Catherine Machalaba is the principal scientist for health and policy at EcoHealth Alliance. I'm sure many of you know her name and the EcoHealth Alliance itself. She was a lead author of the World Bank Operational Framework for Strengthening Human, Animal, and Environmental Public Health Systems at their interface, the One Health Operational Framework, published in 2018, to assist countries and donor institutions in implementing One Health approaches. She's also active in the International Union for the Conservation of Nature, IUCN, including serving for 10 years as program officer for its Species Survival Commission's Wildlife Health Specialist Group. She's also a member of the One Health high-level expert panel, Thomas is here as well, to the FAO, OIE, UNEP, and WHO, in abbreviation, the OLEP, which I'm sure all of you have heard, and we will hear a little bit about that later. She holds a master's degree in public health and a PhD in environment.
You are muted.
You have to unmute
Constanze.
yourself again, Constanze. You were muted. I don't know why, but you have to unmute yourself. Somebody did that. Thank you.
Okay, I'm not sure what you missed, but it can't have been much, hopefully. But let me just round up my words of welcome before I hand over to you, Catherine. Because really this is the third expert talk, and it's great to really move on from Dr. Craig Stephen in December, from Richard Koch and Anand Cáceres in January, and now really look into a more policy-oriented, public health policy-oriented focus. And in doing so, you'll give us some insights in the short time that we have of your wealth of experience, how to operationalize One Health approaches for more coordinated, preventive, and cost-effective systems that actually do promote human, animal, and environmental health, given their integral links. You will elaborate some entry points, trade-offs, and co-benefits when designing effective policy options. And later, you'll probably talk about 45 minutes, I think we considered, and then we'll have time, ample time to exchange views and perspectives, questions and answers. So with those words of welcome, Catherine, let me hand over to you, and the floor is yours, please.
Thank you. Thank you so much for the opportunity. It's really a pleasure to be with you all. And I think that this is exactly the forum that we need to be working together, bringing different perspectives, different resources, strengths to solve these really complex challenges like health risks in the wildlife trade. I think the One Health approach is very exciting because it offers this opportunity to bring different sectors together, to understand problems in a new way that's really more comprehensive, and also to identify solutions that really bring in all of society. So I've prepared a few slides, and I think Hannah will share them because I am technologically challenged. So thank you so much, Hannah, for your collaboration. So I'll be talking about operationalizing One Health, and specifically how the approach can be a very practical, essentially, tool to help us in our work to identify the right entry points, to identify proactively and minimize trade-offs, and also to optimize co-benefits. And this is for the design of effective policy options for addressing health risks in the wildlife trade, as well as other drivers of disease emergence. So if we go to the next slide, I just want to give some background on the One Health approach. So this is a new definition that was adopted in December of last year, so very recent, and endorsed by the FAO, the OIE, UNEP, and WHO. So this was a definition developed by the One Health high-level expert panel, and it really aimed to be very inclusive. So I'll just briefly read it because I think it's important for seeing how we all have a role in a One Health approach and really what can be gained from it. So One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. So there is a lot in that definition. It's really intended to show that a One Health approach can be very beneficial to a lot of challenges that are really core to achieving the sustainable development goals and really require us working together to find solutions. So if we go to the next slide, the visual that was developed to accompany the definition and really show the different components, we see here on the left side, sectors and disciplines. So we typically think of the three core sectors in a One Health approach: environment, human and animal health. Now, of course, we can be talking about human medicine and public health, but we could also be talking about human health behaviors that may shape our interactions with wildlife and other species, and really, be linked to risk or risk reduction. If we look here, then all the way on the right side, society, and thinking about who really needs to be in the dialogue, part of finding solutions, having the buy-in, and really leading on how we design our interventions and implement them. And of course, this includes rural communities, urban communities, nomadic and pastoralist communities, and really at all different scales, so local and national, and also regional and global. And this really reinforces the need to be inclusive, to make sure that stakeholders and their diverse needs are represented in an equitable way, and to make sure that access is really considered for all of society. And then the outcomes. So here at the bottom, when we think really about One Health, the healthy ecosystems, healthy humans, healthy animals, sometimes we may be targeting a problem that is really specific to the health of animals. It may not be directly linked to human health. So it really can be quite diverse in terms of the objectives. I just want to highlight here, collaboration, communication, coordination, and capacity building. Really what we're calling the 3 C's. These are the ingredients for a One Health approach. And as you can see, they're very practical. They're things that we do in our daily work. We get on the phone and call someone when we need to exchange ideas, but we don't always have these knowledge exchanges being proactive or robust. And this is where a One Health approach can be very important to make sure coordination is really routine, and we're bringing together these different building blocks to help us achieve One Health outcomes. So if we go to the next slide, the imperative for a One Health approach. And we, of course, are well familiar with these links between human and animal health, and really the need to move upstream to better prevent, detect, respond, and recover, and utilize inputs from other sectors, especially when we're talking about preventing disease to humans. Of course, as we've seen right now with the COVID-19 pandemic, other species can be impacted, where we're seeing, spillover from humans to other animals and potentially detrimental outcomes to the health of other species. If we go to the next slide, and I'm sorry for that this is showing as a black screen. I'll just tell you a few key inputs of it. So really, when we think about prevention, detection, response, and recovery, sort of these 4 pillars for health security, we need to be thinking of the many different functions that go into that. So, in a way, this is kind of good because it's blank, because it shows us that we all bring something different to the table as part of prevention, detection, response, and recovery. The specific sector or discipline that we're working in can contribute in significant ways, whether it's for identification of the drivers of disease emergence, for threat assessment, for really implementing things like hygiene measures that can reduce the risk of being exposed, but also when we're detecting, making sure that we are really bringing the early warning systems on board. So, seeing that we each have a role in health security, and then you can see the cross-cutting functions. These are really key because we need to be working together to ensure that there's strong and effective governance, that we have workforce development in place so that the capacities that we need are really embedded in our systems and invested in. So if we, and just to say, if you want to see this wonderful figure that our colleague Dr. Carlin and team developed, you can see here the link here. If you just type it in your browser, it'll show up as the first link and you can see the full report. So if we go to the next slide, something very important for a One Health approach is that context really matters. So we see, we want to capture the essence of human health, environmental health, animal health, and the expertise from each of those sectors. But in a given objective disease situation, the relevant roles of each of the sectors and other disciplines may vary. So it's not always sort of the equal Venn diagrams. One sector may be more relevant for a given issue, and it's not everyone working together all of the time, but making sure we are coordinating appropriately to really find the right entry points that are cost effective, to bring in the right sector and at the right point in being able to understand and mitigate risk. To do this, of course, we need strong human, animal, and environmental health systems just to have the sectors at the table and be able to determine those entry points. So really, we also need to be investing in our individual sectors, but making sure we have the ability to work across and come together to understand risks and mitigate them. So if we go to the next slide, of course, when we look at a country level, we think about the drivers of disease emergence. So if we just go to the next slide here, we see that, in a given country, we may have land use changes occurring on a large scale. We may have conflict settings, fragile settings. We may have agricultural intensification, wildlife trade. But in it's really context specific for each country and even each community. So I think having a global understanding of the drivers of disease emergence is very helpful. So we make sure that we are looking at the problem appropriately, bringing in the right sectors. But then when we get to a national and subnational level, I think it becomes very practical in terms of how we target sources of risks, how we really identify them. And it's certain interfaces, certain drivers are more relevant in certain settings than others. So we can really narrow down and target our sources of risk when we look at a more downscaled level, which I think should be very encouraging, because it's not, taking on these massive challenges really across the board, these different interfaces in every setting. It's really targeting sources of risk. So if we go to the next slide, In terms of the wildlife trade, we know these conditions can shape risk of disease emergence. There can also be, of course, risk of endemic diseases, things like salmonella that we may be exposed to from handling wild animals and domestic animals. But of course, these are typically crowded and stressful conditions. There are both disease concerns, also animal welfare and sustainability concerns. And it's a massive scale of the trade, and there are a lot of different species. There's potential for mixing, there's low traceability. So we do have this potential for very complex situations that are hard to disentangle when we really think about sources of risk and targeting and addressing on a one size fits all approach. I think that this is, we have to really recognize the complexity and look at the different pieces of it. But I think if we go to the next slide and we look at the different points in the wildlife trade chain, we see that this is a great visual from the report that Craig Stephen did. I know he presented a few months ago. There are these different components in the value chain, and we can target interventions at each of these sort of different aspects. So whether it's free-ranging wildlife that may be hunted and harvested, and all of the people that are involved in that, whether it's the hunters, whether it's the traders, the transporters, and then people that may be involved in market settings, whether it's the sellers, whether it's consumers that are coming through the market. And this can be happening at a very local level. Someone could be selling wild animals on the side of the road, or it could be a very formal market in an urban setting, or even international trade. So this complexity of the trade, I think we have to recognize, but also, again, really target it to the specific context. And if we just click once more on this slide, we see that, thank you, we see that this is a great example from Sulawesi. Our colleague Elise Latin and the team did this really in-depth analysis to look at the scale of the trade on one island, and really thinking about the movement of animals and who is involved, whether it's hunters, whether it's local dealers, what's going into markets, how many people are really involved in the trade from point A to B. I think once we get to this scale and we see what's happening in terms of which animals are being moved, how many of them, and who is really involved, we see the stakeholders that need to be reached. We see that there may be income needs, there may be food and nutrition needs that we have to take into account when designing potential solutions. So I think having this very broad understanding of the trade chain is very helpful, and then we can downscale to the context that we're working in and really understand the dynamics of the situation and find the right entry points. If we go to the next slide here, thank you, about context. So this was in Ghana on Saturday, this market. You can see there are a lot of things sold in this market. It is a massive, massive market in the center of Accra. Many people shop there, many sellers are based there, and their livelihoods are really dependent on this market. You can see it's mostly vegetables, but there's also fish. You can see some pig in the background, some pig products. And the majority of the market is spices and vegetables and clothing, but then you also have some live animals. So you can see here a live snail. There were also crabs, and I think when we talk about something like live animal markets, wet markets, we have to be very precise, because even what those terms mean to different people and in different contexts, they're not always equally the same for disease risk. We're not worried about the next pandemic coming from a snail, for example. So we really sort of have to target our language when we're working with stakeholders, so that we're also balancing the different needs of people working in these markets, relying on food security, and their way of life. So it's very complex. I think we just have to keep thinking about context and recognizing that disease risk is not equal across the board, and we really have to at least start with targeting the sources of risk that are very significant. If we go to the next slide, So really the science behind this, there's some excellent work that has been done and is continuing to proceed and really understand where sources of risk are, including in the wildlife trade. We can see that certain areas are considered hotspots for disease emergence because of factors including extraction of wildlife, because of encroachment into wild areas, for extractive industries that also facilitate new access to forest areas, and really changing our interactions with wildlife on a very profound scale. There are certainly different practices that pose different levels of risk, and then different species just based on viral richness, what we know is already circulating, but then also what, the unknowns, the diseases, the pathogens yet to be discovered. We can really target based on some viral finding studies to know where we really need to keep looking and where there's this highest risk of pathogenicity to humans. This is an ongoing field of science, but I think it can really help ensure that the science is brought into the policy making too. If we go to the next slide, I just want to show some really interesting work from Ghana with our colleagues from the University of Ghana, the UK Animal and Plant Health Agency. We really wanted to make things very simple when we look at emerging infectious disease risks and thinking about different understanding. I know a lot of people tend to focus on spread factors, especially when we're in a pandemic and everyone is thinking about how do we reduce the risk of spread. But of course, we also need to be thinking about emergence and what makes us really vulnerable to not detecting something early, not being able to contain it, and really thinking about how we can prevent at source. That's really the ultimate goal. What I think is interesting here is the role of protective factors. We don't always think about what is working well that may be protecting us and our communities. So I think when we consider looking at the evidence base and designing interventions, we need to be thinking about all of these. So just in the example here from Ghana, we saw that there is high volume of bushmeat trade and hunting, including of Eidolon helvum. So this is the straw-colored fruit bat, really widely, very ubiquitous in Ghana, including in the capital city of Accra. And I think we can really target the sources of risk. And I think it's very interesting too, because we learned from our colleagues that monkeys are really revered, so people do not hunt them. So that's not a source of risk via the trade, although people interact with them in different ways. So we can really target based on sources of risk. We can also identify our vulnerability factors related to surveillance, related to, for example, lack of quarantine facilities at points of entry. So we might not catch something that could be coming in or out via trade. And then limited coordination, for example, among agencies. So the One Health approach, the opportunities to improve that coordination so that we can really be able to mitigate better and detect and respond effectively. If we go to the next slide, this challenge of why coordination does not happen routinely. So I just want to highlight a bit of work from the World Bank One Health operational framework and this landscape of One Health tools that we looked at. So we did an inventory of the existing tools that are typically used when we think about designing programs at the human-animal environment interface. There are a lot of excellent tools that are really being used to shape investments and to get different stakeholders in the room and working together. So I'll just highlight here sort of what's in place already and what we found in terms of the gaps. And when we think about regulatory frameworks, we may be very familiar with things like the international health regulations. If you're from the animal health sector, the terrestrial and aquatic animal health code, the Convention on Biological Diversity, and many others. And then capacity assessments, such as the Joint External Evaluation under the WHO, planning tools such as national action plans for health security, and all of the other resources that go into implementing them, and information sharing systems. What I think is very important here is that the environment sector is not as robustly resourced in terms of the way that we monitor human and animal health, domestic animal health, typically, capacity and planning. So there is no capacity assessment tool for environmental and wildlife health systems. We have excellent tools developed for human health systems, for animal health, primarily domestic animal health, but nothing really designed for assessing environmental and wildlife health systems. So already we're sort of at a disadvantage going into the process about where to invest, where to target resources, and then when we get to the planning phase, even when it is multi-sectoral, something like the National Action Plan for Health Security or the One Health zoonotic disease prioritization exercises, we don't have that input like we do those formal inputs from the joint external evaluation and the performance of veterinary services. So I think that this is important just so we recognize this gap. I know that our colleagues at the OIE and WHO are really working to bring on wildlife and environmental aspects where possible. But I think it's crucial that we recognize we need something to be able to benchmark against for environmental and wildlife health systems and make sure investments are really targeted to where they can make the needed impact and be able to then support a One Health, really robust One Health system. And if we go to the next slide here, we see that the wildlife integration in existing assessment and planning tools, such as the JEE and the PVS, is really limited. So I see that Dr. Uhart is on the line. Marcy Uhart, we work together with colleagues on an assessment of how much wildlife considerations are being integrated into these assessment processes and these planning processes. And it was, I think, concerning, you know, the limited engagement. I know that there is always an attempt to bring the environment sector to these assessment and planning processes, but there are many different disciplines in the environment sector, and we really have to make sure that we are capturing wildlife aspects as well as the broader suite of environmental considerations. And we found that in the majority of countries that had an existing joint external evaluation or performance of veterinary services report, there was either the note that wildlife sector gaps were really prominent, or there was no mention of wildlife at all, so just not considered in that process. And of course, we know that there's no clear financing mechanism for strengthening national wildlife health systems. And so I think just even in terms of the questions that are asked in existing tools, they're not designed to really capture wildlife health and wildlife disease and pathogen surveillance in wildlife, or those interfaces where we have the risk of spillover from wild animals. So I think we need to consider at a global level, you know, do we need a parallel tool to the JE or the PVS, or is there something that we can do to really make sure those considerations for the wildlife and environmental health sector are brought in more systematically when we get to the assessment and planning phases. And I just want to note here too that you know, I thought, well, maybe then it's in the National Biodiversity Strategy and Action Plan, maybe it's captured from the environment sector. And unfortunately, we saw that was not the case. So really a long way to go, but many different entry points. It could be from the environment sector, it could be from the public health sector in the planning and assessment tools. So I think we just we have to make sure that there's some mechanism to be assessing and really building up the wildlife health system capacity. If we go to the next slide, just to highlight a few key challenges, these are the ones that really do keep me up at night, because I think that they are systematic issues that we need to solve, and I think that they are achievable, but they need to really have that global support and coming together to find practical solutions that that are really able to be put forward, hopefully in the short term, but certainly in the long term. So the first one, of course, is the poor resourcing for wildlife health services, for wildlife health systems to be able to contribute to One Health approaches. But we also see that this fragmented mandate issue is a big problem. So we often have distribution of some wildlife components, such as wildlife monitoring and wildlife protection under certain agencies. Wildlife disease or wildlife pathogens may be under other agencies. In some cases, they're just completely not covered by any agency, or it's unclear, ambiguous, so there's potential for gaps. And I think because of these fragmented mandates, we are really prone to incorrectly targeting policy asks, because it's very hard to sort of navigate this landscape at a global level, sometimes at a national level, of who's the right authority to adopt something. So we often hear requests to the WHO. I know right now with the proposed pandemic treaty, there's a lot of discussion about wildlife has to be in there, but I think we have to be very practical about who is the right authority when we talk about wildlife sector mandates. And we have to, I think, be very precise with targeting our entry points. I will just say, for the pandemic treaty, it is on track to be finalized in 2024. So there is a long way to go. It's really at the very beginning. So I've heard some colleagues say, wildlife isn't included. Nothing is included at this point. So be active in the process, but don't worry that we've missed the boat, because it's really just starting out as a process. And then a second key challenge is the limited understanding of risks and socioeconomic factors. And this is really a result of single sector approaches to disease risks in the wildlife trade. We don't typically think, maybe we should be working with social sciences, economists, anthropologists to understand knowledge, attitudes, practices, willingness to accept alternative livelihoods or adopt safer practices. So I think there's this great role of social sciences, and I will show some examples from work of myself and other colleagues that I think is very exciting for finding new solutions. I want to highlight this third point, that there's no mechanism to ensure timely movement of emergency diagnostic specimens for disease investigations. So if we think about human disease or even domestic animal disease, it's really standard that you ship your samples very quickly to a reference laboratory, you get your diagnosis, and you take action to mitigate the situation. We are really at a disadvantage in the wildlife health community. There are some provisions under CITES that allow for simplified procedures, but they are not comprehensive. There are loopholes, and we have seen that, unfortunately, even in some very large scale disease events, such as mass mortality in saiga antelopes, some marine mammals, and even the elephants in Botswana a few years ago, we're not always able to determine the cause of these mass disease events. So I think this is really a big problem. You don't want your samples to be decaying in an airport because you can't get your permits when there's such an urgent situation. And with wildlife being really threatened by many factors, including disease, we need to act swiftly. We need to make sure that there's this equitable access to diagnostics and the appropriate interventions as needed, the appropriate management of disease. So affording wildlife the same access to that as humans and domestic animals. A lack of emphasis on risk reduction opportunities, of course, is really a big issue. We tend to be very good at responding and making available resources when there is an emergency, but not investing in prevention, although there are some very exciting initiatives that many colleagues on the line are leading on this and really moving towards risk reduction. I think that's incredibly exciting. Keep up the great work, and we have to really keep investing in this and get into showing the value of risk reduction. I just want to highlight this last point too about unreliable information flow. So this is the challenge of making coordination and communication and information flow really routine and in real time to those who need it and can act on it, and to make sure that we don't have these unintended consequences from a lack of coordination when you don't have the right sectors at the table to really design the appropriate strategies. And I'll show a few examples of that. But when we think about wildlife, of course, we have seen these unintended consequences where wildlife are either villainized or really targeted, and it can have very significant effects. If we go to the next slide, so just to show here the example from avian influenza, when we don't work together in a One Health approach, we have seen, unfortunately, more times than we would like to think that there are these responses, sometimes from public health authorities, really, I think, misguided, but lack of awareness about why killing of wild birds is not an appropriate strategy, why it can actually make the problem worse. I know sometimes there has been proposed bleaching of lakes to kill avian influenza virus. And of course, this can have massive ecological consequences that may be far longer term than the crisis of an avian influenza outbreak. So we really have to understand the reasons for having a One Health approach and why we need to be at the table as the environment sector community, or bringing the environment sector community to coordination meetings on big events, but also more routinely. So we start to understand and design from the start biodiversity sensitive interventions. And I just want to highlight the work of the task force on avian influenza. You can see many different organizations are involved in getting information out, making sure that it's with a One Health approach. This is really led by Ruth Cromie and team. But I just want to thank them for making sure that information is accessible and that we are taking a One Health approach to avian influenza events. If we go to the next slide, thank you. So this concept of One Health economics, I think, is very exciting because it allows us to bring information together in a very practical way to understand, hopefully, the co-benefits, but also, again, the trade-offs. So this is a really elegant example from Jakob Zinstag and his team looking at brucellosis vaccination. And you can see here, there's the intervention cost all the way to the left, this purple line. And that's the cost of the vaccine, purchasing the vaccine, deploying the vaccine. And then we see there are public health benefits. There are household income benefits from avoided losses in livestock. There are agricultural benefits. And if we look at these individually, or if we only look at something like agricultural benefits from this vaccination campaign, it may not look very attractive. You know, there may be this sort of marginal benefit, and you say, well, if there's some uncertainty about the cost, you may sort of break even, or it may not be a great investment. But when we think about the cumulative societal benefits, of course, it's really an attractive investment. So bringing together information, showing how important to society as a whole, and when we think about the Sustainable Development Goals, we can really make it very compelling to other sectors. But if we don't have that One Health coordination, if we're not talking with other sectors, those co-benefits can be easily lost. And then also, if we are to have a situation where one stakeholder group or one sector could really experience trade-offs, I think that, you know, there still may be a reason to go forward, but there will need to be mechanisms to reduce the impacts and make sure there's resilience. So this awareness from a One Health approach. If we go to the next slide, just to show how this is used for land use planning. So a totally different context from the wildlife trade, but I think it really is something very practical that you know, we can see the trade-offs, but also the opportunities. So when we think about land use planning, there are many different ways that land could be developed or it could be protected. And we have to think about these different factors. So what is gained when a hectare of land is developed? We of course see that there may be revenue from new industry, there may be new jobs created, and this can be really important for GDP growth. But then we also see that we may give up something in terms of ecosystem services, maybe disease regulation, and wildlife habitat. So I think we have this trade-off about whether to develop land, whether to conserve it, and we need to be thinking about these different components. And this is, again, very context specific, and you know, requires working together to consider these trade-offs or co-benefits. And this is not standard when we're thinking about land planning. This is not the way that, you know, typically we'll have an environmental impact assessment conducted or a social impact assessment, but health is not considered. And the loss of ecosystem services and then impacts on health directly and indirectly really need to be considered, and disease regulation and disease exposures need to be part of that equation too. If we go to the next slide here, if you are a lover of salamanders like myself, you may be very familiar with the chytrid fungus, which has been very detrimental to amphibians, especially frogs, but was recently found to be a threat to salamanders. So something that it was really exciting to see in the United States was this approach to gain different inputs from stakeholders and consider what to do about the threat of introduction of vis-á-vis, so this chytrid fungus, into the United States. And this resulted in actually a very strong moratorium against the trade of 201 species into the United States. It went a step further by also limiting the scope of interstate trade, so making sure that even within the United States, movement of salamanders could not occur via trade. And there was a whole comment period. I know EcoHealth Alliance commented, but many other industries, you know, the traders themselves are part of that process. And there was an economic analysis that went into that. Now, I am really happy with the outcome. I love salamanders. I want them to be protected. I think that if we really take a whole of society approach, you know, there are a lot of things that would have to go into this decision. So salamanders provide important ecosystem services that we don't always think about, related to controlling insect populations. They even have a carbon mitigation service. So I think that, you know, when we really relate it to human health outcomes that are very indirect, and I know EBASE, the Intergovernmental Platform on Biodiversity and Ecosystem Services, is really trying to understand the value of ecosystem services, but there are many services that are not accounted for in decisions related to the wildlife trade and potential introduction of invasive species and pathogens. So I think that this is really a fortunate outcome of the United States evaluation for wildlife trade. But I think we want to get to a point where these decisions are made with a One Health approach in a very routine way, and we are considering the long-term impacts on ecosystems and species and humans. If we go to the next slide, social sciences, I just want to talk a bit about, because, you know, again, I don't think it's intuitive that we work with our colleagues from anthropology, from sociology, from economics, but there is so much exciting work from those fields that we can really learn from. So, of course, the first one is to understand which stakeholders are relevant, that stakeholder mapping, and then go into communities and really work with communities. This is an example here of our colleagues in Liberia, in a community talking about interactions with wildlife, people really providing very honest input about eating bats, about their interactions, and trying to find safer alternatives. And I think, you know, those initial dialogues are very important. You don't get that insight from just visiting a community one time. You have to really have that trust built and the buy-in of the community leaders, and for people to really see why this is important. And then we can start to look at things like nudges, behavioral nudges that encourage people to take safer practices, and then really investing in safer alternatives, whether it's livelihoods, whether it's for food security, and finding the context-specific approaches and solutions. And of course, I often think about this for prevention and detection, but we can also think about engaging communities in response and recovery, and really working with communities to increase understanding, health literacy, and I think we have this opportunity when we are responding to a disease crisis to get people aware. I know during the Ebola epidemic in West Africa, there was a lot of messaging about consumption of wildlife, but not ultimately retaining that in terms of risk, and you know, people saw it as a very short-term risk. And then there was this tendency to go back to consuming wildlife in some context. So I think we have to be very aware of how, when we are, you know, finding these entry points, what we can do to invest in long-term solutions and start building up that engagement and the local solutions and awareness. If we go to the next slide here about improving detection, I just wanted to show a few examples about putting these qualitative methods, these behavioral and biological methods together to understand the picture more robustly. So this is a study in Liberia on improving detection of acute febrile illness events, and then also looking at what's causing them. We often see people coming into clinics and it's assumed to be malaria if they present with a really non-specific fever, but we're not really targeting, you know, is it co-infection, is it actually something else, you know, that's known or novel, and then thinking about, is there evidence of zoonotic transmission, so whether people have interactions with wild animals that increase their susceptibility, so really understanding the risk factors. So we're using both a biological and behavioral survey to do this. And if we go to the next slide here, we see this great work by my colleague Hong Ying Lee. I think Hong Ying may be online, but really looking at the interactions at a community level, at a household level, to see how people are exposed to wild animals on a day-to-day basis. This is focused in rural communities in southern China, and a key finding was that there's serological evidence of exposure to bat coronaviruses, and the value of these qualitative surveys, these behavioral risk surveillance tools to better understand, whether it's through focus groups, whether it's through in-depth interviews, to understand these factors, understand what stakeholders see as viable alternatives, are really exciting for getting us to look at the picture more robustly, understand the links, and then really target sources of risk. So I just want to encourage everyone to take mixed methods approaches, or consider the value of qualitative information in addition to biological surveillance. If we go to the next slide, just to show here, again, we talked about these fragmented mandates and the challenge of targeting which sector we need to work with for policy asks. This is a really, I think, compelling example from China, also work by my colleague Hangying Li, and it shows that there are many different laws in place, and to navigate all of these different laws and stakeholders, we need to have a strong understanding of the system. We also need coordination, because if you only target one law in the forestry department, that's very disconnected from the work in the human health department. So again, the value of One Health coordination. If we go to the next slide here, just to show how coordination structures are being deployed at a national level. This is a great example from Liberia that I have learned a lot from. I think it's a very strong model for putting One Health into action at a national level. There's a formal One Health coordination platform governance manual. The vice president chairs the platform, so you have that high level buy-in. And then there are all these different working groups and sort of different levels to make sure that you have the core sectors engaged, but also the Ministry of Education and Finance and many others. And just to show here sort of what, how the work is happening on the ground, there are awareness campaigns. So these nice celebrations of One Health Day each year that brings together stakeholders and gets them, really enthused about a One Health approach. There have been parades around that on World Rabies Day to get people thinking about dog-mediated rabies. You can see here a vaccination campaign. This child with his dogs that he really loved a lot, and he was very proud to bring his dogs to the vaccination clinic and get the certificate. And he was, really studying it in detail. And then here, this team that was on OKFM in Liberia, this is a major radio station, and this was a One Health team that showed up to get information out. There were callers asking questions, and this One Health team from different ministries was able to answer their questions and really make sure that there was that consistent information and coordination. So I think at a very practical level, the way that countries are deploying One Health approaches is very exciting and a strong starting point for the work that we are linking into. Just very quickly, the next slide, some work also in Liberia, a new project that is aiming to be very comprehensive by addressing multiple threats to biodiversity, but also taking on multiple solutions for these sustainable livelihoods that are conservation compatible. So there are a few different objectives of this project, but some, I think, very exciting options that this project is looking into is how we can grow ecotourism in a very sustainable way, how we can get people to really reduce their consumption of wildlife, especially endangered wildlife, and the species that pose high risk of disease, and bringing a One Health perspective across policy and planning and prioritization, so that we're thinking about ecosystems and environment and protected areas when we're making our wider decisions. If we go to the next slide here, a great example about a tool to get information out and engage with communities. This Living Safely with Bats tool, it is online. It is translated into, I think, 11 languages and maybe 13 contexts with different visuals, different fruits shown. So it's really specific to the region and to be very relatable to communities. But I think it's wonderful because it gives crucial information about the importance of bats to our ecosystems, as well as other wild animals to our ecosystems, and why we don't want to go out and kill all bats, but we need to live safely with them. And you know, if they're living in the eaves of our homes, there may be exposures. If we find a dead bat, or if we find fruit that's partially eaten by bats, you know, there are some simple measures that we can take to reduce risk. So if we go to the next slide here, I just want to show about chimpanzees and wildlife trade, and this example from Liberia Chimpanzee Rescue and Protection, a sanctuary in Liberia that was really established to assist in enforcement. So we see that the chimpanzee trade is very complex. There are, you know, I think very localized effects, but also population level effects from the hunting. And unfortunately, you know, when a mother is killed, when an adult is killed, the baby is often left as an orphan and will die if it doesn't have constant care. So it's really a resource intensive process to care for these chimpanzees. And because of that, some governments are just simply not equipped to confiscate these animals. So there are, you know, really important challenges here because chimpanzees live a long time, up to 60 years. So if you confiscate a chimpanzee, you really have to have the resources to care for them appropriately and either get them safely back to the wild or rehabilitated and have them in a sanctuary setting. So there was no chimpanzee sanctuary in Liberia, and our colleagues started a sanctuary and is really working in closely with the government to increase confiscations now, to enforce the laws, to increase the penalties so they're very effective, and also create a wider awareness so that chimpanzees can remain in the wild. But I think we see that, you know, with these specialized needs for some species, it's not just a matter of confiscating them and then bringing them back into the wild. So I just want to give a few last 30 seconds, if we go to the next slide here, just to show that there are some great tools, this guidance on integrating biodiversity considerations into One Health approaches. Please find this online, please read it and contribute to its implementation. This is really solid guidance for the environment sector to come in and play such a meaningful role in risk reduction. And if we go to the last slide here, just these upcoming initiatives that we can see. I know many colleagues are on the line. Maybe they can speak more to the work of OIE and FAO and World Bank, but really looking at this interface for wildlife, disease risk, and risk reduction opportunities. And if we go to this last slide here, just to share about Panorama Solutions. Sorry, just to highlight here about the great developments at global level. Just to say that the Quadripartite Alliance was formed just last week, 2 weeks ago, and is really significant for including UNEP in that global partnership, and will be, I think, crucially important for making sure that the wildlife and environment components are reflected in a One Health approach. And we see that there's this joint plan of action for One Health that will be launched, and it really includes the scope for wildlife trade interfaces, reducing risk, understanding risk, and you know, I think it's very exciting and will have many implications for work on the ground and at global level. So just lastly here, to show Panorama Solutions, this is such a elegant platform, and it really I think should be very encouraging that although we know there is, you know, a lot of risk and a lot of conservation challenges and challenges for public health, there are also successful practices that are working on the ground and really, you know, cost effective and working with local communities, led by local communities. So I would just encourage you to consider submitting your solutions to this platform. It takes about 2 hours to write it up and get it submitted, and it's really important for that knowledge exchange. So thank you in advance for checking it out and for providing your input on it. I just want to thank you all so much for the opportunity, and I hope that we can discuss more, especially some of the global initiatives and solutions in the discussion, but thank you again for the opportunity.
Thank you so much, Catherine. Do take a deep breath. It feels like you didn't take a breath and moved us through that enormous breadth and wealth of experience and points. I'm sure we could have delved into at least an hour on each of them, moving from understanding risks to really looking into country level context, understanding entry points, not only in wildlife trade, but in others as well. Keeping in mind the precision aspect, you know, what terms, what language is used where, all the way to realizing that there are very few resources for environmental and wildlife health systems and the gaps there. And then in the last, I don't know, maybe 8 minutes, you opened up the whole spectrum of possible interventions on the very local level and community communication, but national level, international level, all the way finishing off with the Panorama website, which I also would like to just highlight. It's a really a very nice way of sharing success stories. So thanks very much.
I think we've lost Catherine just now, but we can.
Yeah, I'm here.
Oh, okay, you're here. Thank God. No, so thank you very much. I don't want to take up any more time with my own thoughts, because already I have the first hand up, and I would just like to encourage everybody to come in here with questions, with observations, enriching or asking or further sharing your thoughts and perspectives. So please, Ricardo, Rusa, please, if you would want to maybe turn on your camera if that's possible, and then please come in here. We can't hear you yet, although your mic isn't. Ah, there you are. I can't hear you, unfortunately, although your mic is on. I'm not sure. If we can't do that, maybe you could just type in your question and we could go into that direction, or come in again and we'll take other comments in the meantime, if that's possible. No, not yet. Why don't you briefly leave the meeting and come back? Yeah. And in the meantime, I'll give the floor to Susanne Grimm. Please go ahead.
Yeah, thank you very much, and thanks, Catherine. So I hope we get the presentation, and I hope I remember everything you said. It was absolutely rich of information and very exciting. I'm from the human health sector, engaging in One Health since, let's say, 2 years now. When you mentioned the challenge that there is no facility in wildlife for timely transportation and safe transportation of specimens, I was wondering whether you have any experience already, and if so, which ones, to link up with existing human health surveillance and response systems, because we try to follow in our projects now the approach of an integrated surveillance and response system, which also means that specimens can be used or can be sent to labs, which are reference labs, which are used usually for the human health sector. But we are often very confronted with this, as you also said, the mandate is here for that and there for that. And so partners are not quite open yet to the actually quite obvious idea to use the same lab for specimens from humans, but wildlife. So do you have any experience already in that? And if so, what can we learn from it? Thank you.
Yeah, thank you so much. And thank you for your interest in this issue. I think it's very complex. So there can be mechanisms if there's an existing scientific really agreement between two institutions that, there's already that registration of the laboratory or of the institution, and it can really make the process work fine. I would say in some cases it works smoothly. In other cases, there are issues with getting the import or export permit, or sometimes both. And I know our colleagues from the OIE are online and have really been looking at this issue, working with CITES. I don't think it's a lack of intention. I think it's there's only so much that can be done under the convention in terms of creating a pathway for really consistent and reliable movement. And each individual laboratory has to be registered and approved, and you still have to go through the process of getting the permits in cases of Appendix 1 species. There are some additional requirements, and of course those are the ones that are really at the most threat in some cases, and you would want to make sure that you have a very quick investigation and diagnosis. So it sort of is counterintuitive in terms of the effect of the convention. I think that it needs additional attention. What we've seen is that there are simplified procedures that were adopted at the previous Conference of the Parties under CITES. They sort of got muddled as part of a larger decision for a scientific exchange, for non-emergency situations. And I think this sort of, it misses the point about why you really need a streamlined process that always works, that reliably will get the disease investigation underway. And if every country had the laboratory capacity to do these investigations in wildlife, sometimes it's not known if it's infectious or toxicological or what the cause is. So you really need this robust investigation. But I think the reality is that that's not the case for the majority of countries. So whether it's a regional lab or an international, a sort of global reference center, we need to find a way to do that. And I think the examples, as you say, from the human health sector that we can build on, sometimes even just using those labs directly, using the OIE reference laboratories. I think this is very exciting, but it needs this attention to find this solution so it always works. And I don't know if our colleagues from OIE can shed more light on our CITES, but I think it deserves the attention to ensure that it is equitable with human health and domestic animal health. Thank you.
Thanks, Catherine. Thanks, Susanne, for that question. Anyone from OIE? I did see Sophie on the line. Anyone who wants to come in here? Otherwise, I do have the next questions and the hands up. So do come in. Otherwise, I'll hand over to Fabian.
Yep. Can you hear me?
We can hear you.
All right. Sorry, my camera is not working. So this is Fabian Lehnder, the founding director of the Helmholtz Institute for One Health. And my question is going, or my comment is going in a bit the same direction. I'm still surprised to see export challenge as one of the main issues. It simply shows how bad we have been in building up the local capacities or in making use of what is there. I mean, in almost all countries, you will find lab capacities, at least basic ones. And with the techniques we have available these days, you simply go there and you can do on-site disease investigations. I mean, we and others have done that for Ebola outbreaks, for source investigations. And I don't think we should push too hard on CITES and opening up the export, because we are going back to some kind of, I would say, almost colonial style type of investigation and research. We should use these moments to put pressure on, well, whoever, the international agencies, funding agencies, to build up more capacities in the countries and make use of these opportunities. So I wonder what's your take on this kind of rapid mobile and investigation, and that's possible. I'm a bit stunned by this, a little bit like, if I hear these comments, I feel like 10 years younger than I am.
Fabian, thanks. It's nice to hear you. Yeah, thank you, Fabian. I completely agree. And I think we have to be realistic. I think that should be the target, that every country is really in a place to be able to diagnose, to detect, certainly for all species. This is still something that's needed in human health, of course, and for domestic animals. But I think that the issue is, that's not something that happens overnight. It takes investment. It takes making sure you have the supplies, the equipment up and running, the people trained, the reagents, day to day. I think you go into labs in many settings, and these are limiting factors: electricity, even water in your laboratory. I mean, I think that we have to be very pragmatic, and that should be the goal, to build up. And there are some very exciting examples with mobile laboratories with really sort of lower relative cost, but it doesn't happen overnight. So I think we need both. We need to have the same equity that we have for domestic animals with reference laboratories, with confirmatory testing. We need to have that for wildlife. And I think the goal should be that each country can do that and has the capacity to do disease investigations in any species. I mean, we haven't talked much about plants. That's a whole other area that really deserves attention, and is quite neglected when we think about marine and other aquatic species. We sort of tend to focus on the terrestrial ones, but I just think we have to be very realistic about what's in place now, and some countries are further along. I think that there are great regional examples where countries are really providing key support at a regional level, and that's very exciting. But the system needs to work, and I don't think it should rely on sort of each country figuring it out. We need to sort of have a system in place where there's that access to diagnostics and access to detection for wild animals.
Thanks, Catherine. And thanks, Fabian, for raising that very interesting point. Karl Schenkel, please.
Good afternoon, colleagues. Karl Schenkel, WHO headquarters in Geneva, working in the surveillance team of the Global Emergencies Program. Just wanted to comment, thanks very much for this interesting presentation, Catherine. Just comment on two ongoing capacity building initiatives we are involved in at the WHO headquarters. One is we are working with the tripartite organizations OIE and FAO currently, or since a while, on cross-cutting One Health's field epidemiological capacities. We've developed a huge framework of cross-cutting competencies, and this in close collaboration with another group that looks specifically into the competencies between linking veterinary and ecosystems and wildlife and field applicable competencies. So that's under Scott Newman guidance, and we're working with these colleagues. Also with regard to upcoming curriculum guidance, so we want to develop a very comprehensive curriculum that points out such competencies that have not been there, but also outlining others that have been here in the existing sectoral guidance documents. Another project is with the Tripartite Plus organizations, OHIS, which is called the One Health Intelligence Scoping Study. So we have been tasked by the UK government in their role as G7 presidency to look specifically into health information sharing mechanisms to detect, verify, and assess events at the human environmental veterinary interface. And we're doing this looking in the high-level UN agency systems, but also into countries' needs and gaps for One Health information sharing. That's also ongoing work, and we are going to deliver a final scoping report and recommendations in end of July. So just to bring your attention to that. Thanks.
Thank you. Excellent. These are really important initiatives, and I'm really, I think that the engagement of wildlife colleagues through the field epidemiology training programs, that's such an important way for applied working together for applied investigation. And I know the OIE wildlife focal points too are playing such a crucial role, and there are trainings around that. I think, there are great initiatives out there. I think we sort of need to invest in the system as a whole and make sure that these approaches that you mentioned are really invested in long term. And I think it's wonderful to see these different initiatives.
Thanks. Thank you, Karl, for bringing that up. Really good. I have, let me just point to Ricardo's question because he couldn't voice his question. He says, please, Catherine, how would you divide it in terms of percentage quantification, stressful conditions? Probably and perhaps divided by continental quadrants. I'm not sure whether you can do that in a minute or so. And just before you answer, Catherine, Elizabeth, your comment, we'd like to hear more about Karl's. That was my thinking just now as well. So let us think about how to bring that in, Karl. Maybe we can have a chat afterwards, how, maybe distribute some more information from you to others. But please, Catherine, do you have an answer to Ricardo's question?
Yeah, if I could just clarify, so the quadrants in terms of risk or stressful conditions, is it sort of, parsing out the different conditions based on the type of trade or the region of trade? Sorry, I'm not able to see the comment itself.
He's putting up the thumbs, so yeah.
Yeah, it's an excellent question. I think, as Carl mentioned, there's a lot of information that is being gained from monitoring. Sometimes it's an issue of data linking. So I know that in terms of wildlife monitoring, in terms, the scale of the trade, which species are involved, there is a lot of information out there that is either paper-based or that is, available, but maybe not linked to then disease risk considerations in terms of risk assessment and prioritization of what to target. I think as you get to a regional level and a country level, that becomes more clear, and it does become more practical. Some countries have a lot of importation, a lot of trade coming in, a lot are primarily exporters. Some, it's mainly reptile trade. Some it's really trade in bats or rodents, or so I think at a regional level, you can start to target it more. And of course, the pathogens of concern are then, you can really get to the sources of risk and think about what's relevant for human health. I think for the welfare conditions too, the stressful conditions, some of that is husbandry, is it the nutrition, the well-being of animals, and it may be very different, the context in a market, in a context of shipping animals and which animals are exposed to other species and viral shedding concerns. But I think because of the lack of traceability of the trade, that's very hard to sort of pinpoint. But as you get to a more downscale level, that traceability becomes a bit easier. But it's a great question. I think we need to be bringing together these different sources of information to start to look at risk in a more kind of localized level and more along the different types of trade and different species involved. Hopefully that's relevant. Yeah, if there are, I'd love to hear your thoughts on ways to do that. Thanks.
Thank you. Excellent. Let me hand over to Mark, please.
Thank you. I'm just trying to get my camera on. Hi, Catherine. Nice to see you. It's been a while, but it's great to catch up again. So just actually building on that previous point there, I wanted to see kind of how you think that we can integrate. You showed a couple of examples, particularly in Sulawesi and in China, working kind of with smaller community groups, trying to understand where the pathogens are coming from, where trade is coming from, and the pathways. So how can we better integrate kind of those the people in societies and the small NGOs into these policy discussions to be able to kind of have more localized, not treaties necessarily, but more localized input and better integration into programming from, including more local communities in that.
Thank you, Mark. It's nice to see you, and thank you for the wonderful question. We really learn a lot from all of our local partners at universities, from NGOs, from the government. I'll just highlight the work of our colleagues at the Society for the Conservation of Nature in Liberia, and they set the course of how to approach communities. So they said, okay, we need to go to the county superintendent, talk with them first, get them really aligned with the project. We need to go to the healthcare facilities and, hear about what patients are coming in with, and, are they seeing loss of fever? Are they seeing suspected malaria cases? What, do they have a sense of sort of exposures to other species? Are they collecting that information? Sort of putting together the puzzle almost at a very, at a district level, at a community level. And, that can take some time. That can take multiple visits to sites, getting, the leadership on board at a community level before you even, start your activities. So I think it's a chance to, I think there are a lot of different efforts and different research groups. And I think the best thing we can do is work together to get, an integrated approach. I know that's very hard to do, but I think these One Health coordination platforms are sort of helping to make that the norm. So getting everyone together, promoting collaboration, almost setting that expectation. And that is an expectation for NGOs too, to really do things in a coordinated way. I think, it really is community dependent. And again, Panorama Solutions, it can be as, really specific to communities, something that has worked in one community and seems to be, something where we can learn from the building blocks. So please do share those. I know your own work, Mark, you have some great examples and of, how to do that at the stakeholder level and even identify the right stakeholders and entry points. But I think it's an area we all need to be learning from one another about. Thank you.
Thanks so much, Catherine.
Thank you, Mark, for that. And thank you, Catherine, so much for that. It seems like we really bulldozed through this hour and 15 minutes. We could have continued much longer, but since we want to stay true to our timing, I will have to wrap it up here and just leave all of you, well, first of all, really a very heartfelt thank you, Catherine, and I do hope that it's a start and not an end to our conversation with all of you attending. And it feels, coming from the Oscars weekend, it feels like more like a trailer rather than the fully fledged, cinema experience right now. And I'd like just to point out that this is maybe really a trailer into what we as the Alliance Against Health Risks in Wildlife Trade do and will be doing and will be continuing doing, what issues we want to address, how we want to really increase insight and by pooling knowledge, by pooling experience and perspectives, and to really help realize the ideas come into life, some of which we have touched on today, and with whom we work, which is all of you. So whoever hasn't been in touch with us, who hasn't engaged with us yet, please do find us online and just get in touch with us. We'd really like to have you on board. And with that, I'll leave you to it for this afternoon. Thank you, Into the World. Thanks, Catherine, again. We're really looking forward to continuing this conversation and taking up some of your challenging and brilliant ideas and experience that you've shared with us and with everybody else. Thanks so much and be safe. All the best.
Thanks, everyone.
Thank you.